Now, with the advent of technology, there are various patients who are, getting treated by cancer. They are getting cured by cancer. So, whenever we have a cancer survivor, or we call it cancer winner, there's so many issues which are coming in long term. For example, in a breast cancer patient, if the person is treated, cured from breast cancer, she will have so many psychological issues that depends on how the patient has been treated earlier, how the patient has been underwent surgery. If the breast has been removed, she will always have a problem. She will always have a psychological issue, and she will have a cosmetic issue that the breast is not there. She will always think about it. So you have to plan in a way that we have to think that the patient is going to survive long, and the patient's psychology has to be taken into account. Long-term effects on cancer patients depend on various factors. Most importantly is the age of the patient and primary site of the disease. Age of the patient means if a younger patient is diagnosed with, say, bone cancer or testicular malignancy, the effects will be profound. If a female is diagnosed with breast cancer and she underwent mastectomy, she will have cosmetic issues and she will be psychologically down. Or a patient who has been diagnosed with head and neck cancer, he will have facial disfigurement. So, for all patients, we always recommend there should be a multidisciplinary approach to treatment. A comprehensive plan should be made so that if the patient survives longer, what kind of issues we are going to have. Say, if we have a young female who is diagnosed with ovarian cancer or breast cancer for that matter, we have to give chemotherapy. And many times the patient is desirous of having a child. But when we give chemotherapies, ovaries don't start, they just stop functioning. So we need to tell the patient that there are options available. We can preserve her ovum so that subsequently, if she wants, she can become a mother again. So this kind of thing is there. So at all cancers, at all treatment plan, there should be a multidisciplinary approach, and we should always have a psychologist with us whenever we are taking treatment. We are making a treatment plan for the patient. Cancer, when we treat and diagnose, we always stage the disease. Staging the disease means we should know how far the disease has gone. It is different from other diseases. It is not only present in the primary site, but it goes to lung, liver, neck, brain, and everything else. So what we need to know is we need to know stage of the disease. By the stage of the disease, we have to do a PET scan. PET scan will show where all the cancer cells have gone. So early the disease, the better the survival, the more the chances of cure is there. And if the patient is having an advanced disease or a locally advanced disease, the survival and the treatment is prolonged. So most important factor as far as the prognosis is concerned is stage of the disease. And for stage of the disease, we should get a PET CT. Cancer, unfortunately, is a notorious disease, and it is, very, very common that it recur. Recurrence of cancer depend on the stage of the disease. Early disease, the chances of recurrence are less if the patient is treated properly. But if a patient is presenting in stage 3 and stage 4 disease, the chances of recovery are less and the recurrence is more. So we have to plan. And secondly, whenever we are treating the patient with chemotherapy, with radiation, these also causes cancer in some way or the other. It is said that whenever the patient is receiving radiation, 1/6 of the patient will get second malignancy. So we have to plan accordingly, we have to treat accordingly so that the patient is having less and less chances of getting a second malignancy. And whenever second malignancy is or a recurrence is detected, the general condition of the patient and prognosis is always poor. Most important lifestyle change is abstinence of alcohol and tobacco in any form. We are seeing a lot of patients, even after diagnosis of cancer of head and neck, they continue to smoke or they continue to take alcohol. It is foremost important for the patient to stop this carcinogenic products. That is, you have to stop them because once these are the causes of cancer, you are again taking it. Secondly, you should always take a healthy diet. Diet in the sense, I always say to my patients that you should have all colors in your plate. You should have red, apple, green, vegetables, yellow, lemon. So all colors should be there in your plate. You should not be monotonous food should not be there. And seasonal fruits and vegetables should be there. Thirdly, you should go less and less on red meat and processed food. This causes a lot of issues. So you should go less and less on processed foods and meats. Fourthly, physical activity. Many times we see whenever the patient is getting treated or whenever the patient is operated, he is just restricted to his own room or own home. So we always tell them, be physically active, go out, have some walk, play some games. So this kind of activity is going to improve his overall health and subsequently his will to fight and recovery will be better. So food, diet, and most importantly, have a stress-free life. If you are going to think that I will have this side effect because of this treatment, I'm sure you will have it. You have to fight it. There is no other way, and there the only thing is that you have to win it. Whenever the patient is treated for cancer, be it radiation, chemotherapy, or surgery, we always ask the patient to have a regular follow-up. First reason is that many times we have to see for complications of the treatment, side effects of the medications, or any deformity or any functional loss is there. So we have to rehabilitate the patient. Secondly, the follow-up is required because 1/6 of the patient will have a second malignancy subsequently down the line. So we have to find that second malignancy, if at all they happen to occur, we have to find it at earlier stages. Thirdly, we have to see whether the patient is built up nutrition, health, and everything else. Thirdly, we have to see whether the food, the health, the nutrition, and everything else is going as per plan or not.